Hey everyone, and welcome to 4x11. Today we're diving into one of the coolest parts of CT imaging, how we turn stacks of slices into stunning 3D visualizations. Let's see how techniques like MIP, MinIP, and volume and surface rendering bring anatomy to life. We are going to discuss about the few important post-processing techniques, which include multiplanar reformations, that is MPR, maximum intensity projection, that is MIP images, minimum intensity projection or MinIP images, volume rendering, and surface rendering. So let's begin. Let's talk about multiplanar reformations first. As we learned in our previous video, the CT acquires data in the form of slices which have area as well as width, which means they are three-dimensional structures. Now, stacking these slices above one another gives us the data about the whole scan, and this is called volumetric acquisition. This volumetric data can be now viewed in any plane, be it axial, coronal, or sagittal, or even any oblique plane that we want, using mathematical manipulations, thus giving us images in any plane. This is an illustration as to how we can view data in different planes. Look at the topmost image. All the small boxes represent voxels, and their 2D representation on our computer screen is a pixel. If we select the voxels in axial plane to view, we get axial sections. However, we can view coronal, sagittal, or even oblique sections, as shown in the lower two images using the same data. So in short, even though data may be acquired in a particular plane, since the acquisition is volumetric and three-dimensional, we can mathematically reconstruct images in any plane that we want. These are multiplanar images of a head CT in the three planes, that is axial, sagittal, and coronal planes. Look at these colored lines. These lines can be rotated at any angle, thus giving us oblique sections in whatever plane we desire. Herein we see that how manipulating the axis can give us oblique images in whatever plane we desire. Beautiful, isn't it? Radiology is beautiful. Now let's talk about maximum intensity projection, that is MIP, and minimum intensity projection, that is MinIP. Look at the image at center, which is normal lung window of chest. Now look at image on right. There we see that vessels are seen more clearly. Bones are also highlighted. Now take a look at image on left. Hear how nicely we the trachea and bronchi. But how did we achieve this? Some smart brains designed techniques to manipulate images in such a way to see desired structures. These ways are MIP and MinIP. The computer analyzes the dataset along a viewing direction, projecting selected voxels onto a two-dimensional plane. For maximum intensity projection, the brightest voxels are chosen, highlighting dense structures. For minimum intensity projection, the darkest voxels are selected, emphasizing low-density areas. This technique enhances structures of interest while minimizing background interference. MIP selects the brightest voxel along each line, highlighting dense tissues like bones and contrast-filled vessels. MinIP, on the other hand, chooses the darkest voxel, emphasizing low-density areas such as airways and lungs. These techniques allow for detailed visualization of specific structures within complex datasets. Take some time, look at this image, and try to understand what is happening here. As the system looks through several sections, it selects the voxels with maximum intensity and displays them on the projected image, giving the so-called maximum intensity projection image. Fascinating, isn't it? Now coming to the uses of MIP images. Since they help us visualize the blood vessels better, they are used in CT angiography and CT venography. They can also aid in bone evaluation. One of the important roles in chest is that of differentiating lung nodules from blood vessels. They help in lung nodule detection by enhancing small, high attenuation structures like nodules against the dark lung background. It also helps differentiate nodules from vessels, because nodules appear as discrete rounded opacities, while vessels maintain continuous branching patterns across slabs. Here in this slide, you can see two most important uses of the MinIP images in CT, that is airway evaluation and biliary tree evaluation. MinIP is very useful, but very less commonly used, at least much lesser as compared to MIP images. All right, now let's talk about volume rendering, or VR. Volume rendering is a 3D visualization technique that lets us see the entire CT dataset as a realistic, three-dimensional image, not just flat slices. Here, every voxel in the volume contributes to the final image, like the images shown here, and this is what makes images look lively. But how does volume rendering work? The computer assigns each voxel a certain color and transparency depending on its density, or Hounsfield value. When all of these are combined, they create a lifelike 3D model that you can rotate, zoom, and view from any direction. Unlike MIP or MinIP, which only show the brightest or darkest voxels, volume rendering uses all the voxel information, giving a more complete and natural-looking picture. It's especially useful for surgical and interventional planning, for fractures, vascular mapping, and to understand complex anatomical relationships. Here, see how beautifully the bones are depicted in these images, giving realistic, complete view of the bony anatomy, great for trauma assessment and surgical planning. This is a volume-rendered 3D CT of the chest vessels. It beautifully shows the aorta and major branches in their true spatial relationships. VR helps in vascular mapping, aneurysm evaluation, and surgical planning. Several presets are available in the DICOM viewers to choose from that can help us create different volume-rendered images as shown in the figure above. Truly amazing technology, I'd say. I love it absolutely. Look at these images. Can you imagine that they were reconstructed using CT scan data? You can almost identify the person, see how clear even his veins are visible. This is beauty of radiology. And this technique wherein only the surfaces are reconstructed is called as surface shaded display or surface rendering. It's especially helpful in facial and cranial trauma, orthopedic planning, pre-surgical reconstruction, and prosthetic design. Thank you guys. This was all for today. I hope you liked it. For more radiology content, visit our website, www.4by11.com. Have a good day. See you in our next video.